Subscribe now and press the bell icon. Never miss an update.
Hello, I'm Wade. I'm from the US. I came to India for a hair transplant. Hi friends, I'm Dr. Vikram and today we'll be doing a live surgery for Caucasian client. He's from USA, he's a businessman in USA, age is around 56 years and he's suffering from grade 6 baldness. Usually we deal, like most of our clients, they are Asians, and the kind of hair transplant we do in routine is different from Caucasian hair transplant. There are certain differences which make Caucasian hair transplant little difficult as compared to the routine Asians we are doing. Number one is the number of hair. They are much more as compared to Asian hair structure. So per graft number of hair, they can be like 3 to 5. So chances of transaction are much more if the choice of internal diameter of the punch is not right. Second, density, they are very heavily packed. Most of the cases they are very heavily packed and you have to really be careful for transactions in that case also. Third is the depth or the length of the graft. It's more as compared to like the Asian clients, and that also makes it little difficult to extract these grafts and to prevent transaction. So all in all, our speed is little less while doing a Caucasian hair transplant, and the required number of grafts, definitely they are lower as compared to the Asian clients. So I'm planning around 4,000 grafts, but the final count will depend basically upon how much is the ratio per graft of the hair we are getting. So in his case, I'm expecting more than 3. So somewhere around 4,000 grafts, they'll be good enough to cover the entire scalp from front to back. This is called test extraction. We have extracted almost 50 grafts and now we understand that how deep the grafts are placed, what's their angle, and the kind of punch we are going to use to extract maximum number of grafts. So all these parameters we decide in first 50 follicles. This is our, you can say this is like test extraction. 50 to 100 grafts are taken. In this case particularly we'll be using 0.9 millimeter internal diameter punch. And with that we are going to extract almost the kind of density I am looking. It's going to be somewhere around 2.8 to 3 hair per follicle. So that's a pretty good density. So 4,000 follicles or 4,200 follicles will be good enough in this case. So we'll be counting follicles, we'll be arranging them according to the number of hair they are carrying, and then finally with this strategy we are going to calculate total number of grafts required. So that's it. After test extraction, now we come to know the actual anatomy of hair, the kind of angulation, the depth, everything. So now we'll be starting extraction. As we discussed in the morning, I was planning around 4,000 grafts. But then donor area is good and client himself requested to go for the maximum possible number of grafts to cover entire thing from front to back. So based upon the request, we are going beyond 4,500 grafts. Let us see what kind of quality we are getting, and I'll try to touch 5,000 grafts, but then we'll do as much as possible safely. So now we are in middle of extraction. We have done almost like 60% of total required number of grafts. I was telling in the morning that I anticipate some kind of difficulty in this client because of age, one, and second being Caucasian, the length of graft is much more as compared to the routine cases we do. So it's very important to choose a particular area from where we are going to extract the grafts. Like this particular client is having maximum thickness and the kind of quality of grafts in this upper zone.
Yeah, so the extraction phase is over. They extracted 4,800 grafts and seemed to go pretty good. All in all, there was no pain and feeling pretty good. Ready for the next phase.
So now we'll be discussing a hairline. We have two options. One is as I made it in the morning, as this thing, and second is we can go exactly according to your existing hairline. So the choice is yours. You can just have a look. Extraction has been done, and we have got almost 4,800 grafts, so they'll give very good density from front to back. So in front we'll be putting 700 to 750 1 and 2 hair grafts, and the rest of the filling we'll do this in entire area. So now we'll be giving anesthesia in this frontal region. So primarily we'll block 2 points this way and that, so entire thing will be covered. And then we'll do slitting, and after slitting we'll go for plantation. Front anesthesia has been done. So how was the pain? Like
It wasn't bad at all.
1 to 10?
Yeah, probably like a 1.
Oh, so you're good at your pain tolerance then. All right. Same was there on the back side also.
Yeah.
Huh? Okay, perfect. Now we'll be starting with the next step, that is slitting.
Okay.
All right. I'll make small holes all over the scalp for grafts to be left. They'll be placed in those slits later on. Right, sir?
Okay.
Okay. While doing punching at this crown area, we have to be careful that we have to follow the direction of existing hair. We have to create that particular whirl which we normally see on this crown region. So that gives an aesthetic look. In case if we are putting grafts like in front direction or just throwing them back vertically, so they don't give an aesthetic look. So that's why we are creating a whirl pattern. A nice whirl will be there on this crown region. Now this is a very unique device which I have developed myself. So we keep a very precise count of our grafts. Like for example, we are doing 700 single follicles in the front area. So it's a precise device which keeps counting me on the other end, so that we are able to distribute our grafts wisely, like singles in the front, then the 2 hair grafts, and then 3 and 4. So this precision is required. You should be able to count each and every graft where you're going to place. So we have completed our step of slitting. So exact 4804 number of slits have been made, And the distribution of grafts, as I've already explained, like in the frontal row, we'll be putting single here, then 2, then 3 and 4, and rest from there. We have created wall also on the back of the head. Temple triangle deliberately I haven't made because we have to honor age also. Right? So he's around, gentleman is around 56 years old. So if temple triangle is weak, that gives a very natural and a fair kind of look.
So we just finished up with the procedure, and everything went real well. I experienced very little pain throughout the procedure. I'm extremely happy with the procedure so far. Dr. Vikram performed all the important steps, and his staff was very professional. The doctor was very knowledgeable, explained everything really well, and I'd highly recommend NEOGRAFT Clinic to anyone who needs a hair transplant. And they did a great job. Thank you.
Procedure is all well done. All right, and just have a look. So the bandage, which is lying just beneath this, you don't have to remove this bandage.
Okay.
All right. When we instruct you to remove bandage, or rather, I think you're coming here for your head wash.
Yes.
You're staying here, no?
Yeah, I'm going to be here for a couple of weeks.
That's perfect. This bandage is not to be removed.
Okay.
The top bandage will remove after 2 days. That's it. You must have read a lot of things about our clinic, feedbacks and everything. So, do you find everything was truthful there? Like everything
Yeah, I
was
was impressed. You did a great job. The clinic was clean,
and
nice.
and
The staff was nice.
and all, like the reviews and all, everything, they were all true in the sense that the kind of expectation you were having in your mind.
Yeah, I if I didn't believe it, I wouldn't have come. So, but they seem genuine. So
Yeah.
the results kind of spoke
Results
for
definitely
themselves.
they are going to be genuine. Definitely.
Yeah.
Because we have done it ourselves, so we know like quality of grafts and everything, and we have distributed in such a fashion.
Yeah.
So you're going to get amazing results. So choice of clinic does matter. Now, as you understand, at the age of around 56 years, it's very difficult to lie continuously for 2 days. Most of the clinics, they do FUE around like 2500, 2600 follicular units in a day. But we have modified this technique to an extent that we are now doing almost 7,000 grafts in one single day. So it was pretty comfortable at his end. Lying down in prone position on his belly for almost 2.5 hours, then sitting in supine position for another 3 hours. So all in all, it was very comfortable. And this Neoplatinum, the new strategy which we are using in hair transplant, is pretty fast. And you understand like this, the speed matters, because the body out time of grafts, if it's more, then definitely graft take up rate, it goes drastically down. And otherwise, like as we previously used to do, it was like 2500 to 2700 follicular units in a day. Then you can very well imagine like continuously 2 days, if you're lying in an OT for 8 hours regularly in one day and 8 hours regularly second day, it's very kind of painful, and muscles, they all go into spasm, and it's little difficult. So today, sir, it's 14th day.
14th day, yes.
14th day. So how was your journey from the day of transplant till today? Can you please brief the kind of problems you had to face, kind of difficulties you faced, please?
Well, everything went really good. The only thing would be, I did have some slight swelling, I think, on the 4th and 5th day, but it went away, no problems.
Okay.
No real pain. I did have some scabbing that took a little while to go away, which is normal.
Scabbing must have gone by day 12 or...
Yeah, it was gone by day 12.
Yeah, perfect.
And mainly just, the only thing would, no pain, just a little bit of itching, which is normal.
Itching is like part of your healing, right? So it signifies that your body is trying to heal up the things. So a little redness in your case, because you are a very kind of a fair-skinned person.
Yeah.
So in that case, redness is going to be evident for a few more days, and we'll give some medicines also to soothe your skin and all. And the only thing what I want from your side is do not go directly into sunlight for at least 6 weeks.
Okay.
That's very much important. And day 10 onwards, as we suggested, that you can carry on with your physical activities and everything. So your daily schedule is normal from now onwards.
Exercise also?
Everything.
Yeah.
You can go ahead with anything.
Good.
So just please. So a little redness you can see, but nice density, nice distribution of hair. It's very natural. Directions you can see, density and direction, they are perfectly fine. So this is day 14. So this area particularly is a borderline zone. So as age increases, there's little problem in blood supply in this place. So thoda sa, like in this area, we put density little lower as compared to like, so all in all, he'll get a coverage of more than 95%. Would you like to recommend your friends for this clinic?
Yeah, I definitely would. Yeah, I'm going to.
As in India, we say there's one word in Hindi, Atithi Devo Bhava, like our guest is our God. So this is the kind of perception we have for the people who are traveling from such a far off place to get their treatments done. We do the best we can.
I'm definitely been happy so far. Everything's good.
So you carry a good memory, kind of a good result with yourself. So that's a kind of appreciation for us. Thank you so much for allowing us to shoot this video.
Thank you.
Right.